Because this is a professional device, it's made specifically for this role. A lot of the pens up there are repurposed tattoo pens for eyebrows, whereas this is literally specifically for it. So a little counter 2, you'll feel a little light pressure, so just my finger, and then 1 and 2. So this is just a little series of those 12 little microneedles, just working away. How did that feel, Joe? Feel quite comfortable?
Yeah.
So we'll just switch it to 0.5 there, so just a little bit more. This will give us a better result. And 1 and 2. So we just slowly and steadily, methodically work it over the whole area. As you can see, nice and comfortable, nice and predictable. I actually find it quite relaxing. You can hear that kind of rhythmic tap, 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 tap. Once we complete our little treatment, we use a series of little moisturisers, and we have these great collagen gold masks that we apply. I'll show you all for in a moment. Can you see there's just a little bit of light reddening in the area? Nothing too major there at all. I'll just get a little bit of serum, and we'll bring it around just so I don't dribble on you.
I don't have a job like you know.
I had a friend that was actually telling me how she went for this, but she was telling me it was really painful.
If you're having it, I'm just going to feel it again. If you're having it for as a roller rather than this bit of equipment here, or automated one, and the actual hand rollers are painful, because as it comes in and out it tears the skin a little bit, whereas because the angle of this is directly perpendicular, it's a lot more comfortable. I've had this treatment done myself, and I could generally fall asleep during the treatment itself. It's going to increase the depth of touch in terms of the cheek, because this is a slightly deeper area. Sometimes you'll see people do what's called a vampire facial. What they do there is they actually take a sample of the patient's blood, they put in a special machine called a centrifuge which spins around, and from that they then take a sample of the various different tissue factors and proteins, and instead of using a serum, they then put the patient's own blood back into their face. If I'm honest, it's a little bit more gimmicky. There's no benefit from using the patient's own their own blood sample in centrifugation compared against using predetermined specialist serums, because this has a higher concentration of the active ingredients depending on what you actually want to treat. So for instance, we've got serums which work on problem control skin, so if people are prone to breakouts, we can use a different serum which has slightly different active ingredients. We also have, if you want anti-aging, we've got ones which contain a much higher concentration of the hyaluronic acid, the HA, which people are getting obsessed with at the moment because it's one of the major...
Hyaluronic acid, you say?
Yeah. And then we also have ones which will have a little bit of a cocktail of everything, so it's a little bit of an all-purpose serum.
Is hyaluronic acid associated with anti-aging then?
It is.
I thought it was associated with hydration.
It's a hydrating agent, so it plumps and gives the volume, which is why you get the benefit. So like actual dermal fillers are made of 90% of this HA, and the lips themselves are made of about 70 to 80% of HA. So again, you'll just feel that little gentle motion.
Yeah, like you say, everything has hyaluronic acid in it at the moment, doesn't it?
That's everything. It. But if you're not doing microneedling, it never actually enters the skin. Well, 10% is entering the skin. You're not really seeing the full benefit. I'm not saying not to do it, but if I was choosing between products, if it's just home use, home creams, I wouldn't spend the earth on them because you're not really seeing a major difference.
Okay.
Those little home rollers, as much as I don't like the rollers, if you just get a 0.25 roller, put the cream on, whichever cream you decide to use, and use it in conjunction with home rollers, you're going to increase the actual rate in which it gets absorbed.
But won't after a while using a roller all the time affect? Like won't those pores then constantly be there? Do you know what I mean?
I know what you're saying, because it's only the 0.25, you're not creating major micro channels or anything. Yeah. If you were really pressing very hard, you could cause some skin thickening because you could create skin trauma, and then, like with anything, if you traumatise an area, a bit like if you imagine your feet, if you walk barefoot every day of the week, you'll then start to get hard skin. But if you suffer from rosacea, where some people get reddening of the skin randomly, you actually want to encourage that skin thickening, because that's going to create a little barrier between the actual deeper blood vessels and then the outer layers of the skin. Next time we can go a fraction deeper, we'll be looking at 0.5 on the forehead again, but on the cheek we'll actually be going a full 1 mil depth rather than at the moment we went 0.75. But for first treatment, just to see how your skin responds, we keep it on the slightly lighter side. I was just rubbing in some of the serum again because we've opened the channels just to make sure it's getting massage into the pores. Here again we've got our intense collagen mask. It does mean you're going to look a little bit like Hannibal Lecter for the next 5 seconds or so. But again, these feel amazing. Normally what we do is we place this on, leave it on for 10 minutes whilst it works away. And these feel amazing. So this is where it would normally be playing our whale music and you'd be relaxing again.
What's in that mask then, if you don't mind me asking?
So at the moment, a lot of it is actually more calming, like a glycolic, almost like a sugar, and then but not a glycolic acid, just an actual glycol. But then we've also got a high dose of collagen, direct collagen on. Again, because we've created those microchannels, there's a way for the actual collagen to be absorbed and taken up into the skin. It also has a range, it's got 8 different polypeptides, the proteins that make up the skin. It's got a range of those, and trace elements, so copper as well, which is a natural skin cleanser as well. So it's a little bit of, it's our secret weapon. This really does help to just boost the skin. So yeah, we'd leave it on for 10 minutes. Once that's been 10 minutes, we take it off, and then we have our Hydro Smoothing Cream, and then we also have our little SPF, as it gone, daily moisture. So we just put those 2 on, and then that's the treatment complete.